everyone. Welcome to Massage Implications for Reproductive Pathologies. Now, as I go through this PowerPoint, for those of you listening along, I am only going to be talking about massage implications for our clients and respective pathologies of the reproductive systems. For those of you in class, please feel free to pause at any time if you want to look at the PowerPoint, or download it inside the class to be able to read it, or use an e-reader to access the text portion of it. I will not be talking about anatomy and the details of the pathologies today, as we are only concerned about the massage implications of them. All right. Please go back to earlier lectures or assignments to get details on the anatomy and pathology breakdown. All right. That being said, here we go. The first thing that we are going to talk about is menstruation. Now, one thing I will mention really quickly is if someone tells you that they have amenorrhea, remember from our anatomical terminology, anything with a or an in front of it means without. So without amenorrhea, without menstruation, it's the absence of menstruation. This person will not be emitting any sort of biohazard body fluid in the form of menstrual blood on your massage linens. You are good to go. The only thing is if they tell you that they have amenorrhea, there's very usually something medically or chemically going on that would cause this, unless they are actively in menopause or pregnant. So please make sure that you find out any comorbidity that you would need to adjust for in the massage if they are experiencing amenorrhea. Amenorrhea itself is absolutely indicated for massage. Not bleeding is not a problem. The reason why may be a problem. Now, massage and menstruation. You might suggest that they leave on their undergarments. I like puppy pads, the little 1/2 meter by 1/2 meter sheets, the like 2 foot by 2 foot, that you would put down on top of a massage bed. What you would get in the pet aisle, in case you are potty training a puppy in the house and there's any leaks on the floor. These are amazing because they have a very soft cotton top that is going to be very soft underneath the sheet or even on it for someone to lay on. It's going to properly cover the underside of their body all across their bottom, from above the buttocks down to about mid-thigh. So if anything did leak through the undergarments, or if they chose to not wear undergarments, this would protect your linens and you would not get anything on them per se, except for maybe the top linen. Just as a suggestion if you wanted to try that. Now, definitely err on the side of caution because blood is biohazardous. We can catch many diseases through blood. So please be careful. Please know that there are options though, and menstruation is an absolute indication for massage. You can absolutely massage them. Now, menstrual cramps may cause a lot of discomfort. And in fact, the term for menstrual cramps is dysmenorrhea, dys for dysfunctional. And in your licensing exam, you will often see the question, what is painful menstruation? That is dysmenorrhea, menstrual cramps. And there's a fantastic massage maneuver for this, where you move inferior to superior on the posterior thigh. So you're starting just superior to the back portion of the knee. You are gliding up the back of the thigh using this forward downward diagonal stroke into the ischial tuberosity to apply pressure similar to a trigger point, but a little bit more broad pressure on that ischial tuberosity will very often relieve some of the cramping done during dysmenorrhea. Now, the next thing we're going to talk about is pregnancy. There are 3 main trimesters of pregnancy. The first one is very volatile and an absolute contraindication for massage. If someone is in the first 3 months of pregnancy, they are prone to spontaneous abortion, miscarriage. Things could happen chemically, medically. The sperm could be of such quality that the body rejects it. A miscarriage occurs. You do not want that blamed on you. You do not want to be the cause of this for any reason whatsoever. So please, by all means, avoid all pregnant people in the first trimester as their body builds and protects this life that they are creating. And then we can talk about massaging in the second and third trimester for safety. High risk pregnancy. This is a case by case basis, usually a contraindication or at least a local, depending on what is going on. We're going to talk about the diseases involved in high risk pregnancy separately in just a little while. All right. Massage and pregnancy in general. So we're going to get into modification of techniques and body positions. We're going to talk about specific sides for side lying, semi reclining supine. These are all important. One thing that is noted very often in your massage text is that massage and reflexology can be administered. I have to say here, please make sure you do not have a basic elementary training in reflexology at this point if you're going to massage someone who is pregnant. There are points on the body considered to help with labor, potentially may cause preterm labor, early labor, right? We don't want anyone having their child early because of faulty reflexology. Please make sure that you are certified, you feel fully comfortable on the areas that you are supposed to avoid in this. We can talk about this in another lecture. But for now, just know that you need to be very confident about your points if you are going to administer reflexology, especially on the feet, lower legs, and hands of a pregnant person. All right, massage and morning sickness, nausea, vomiting, or emesis. All right, it affects 75% of pregnant people in the first trimester. Doesn't matter to us because we do not do the first trimester. However, if they continue to feel nauseous in their second and third trimester, make sure that you're using a semi-reclining or fully upright position while you massage their legs or do any other work while they are supine. All right, avoid techniques that are causing them to rock or shake frequently and have an emesis bag available. I know if you've heard my other lectures, I tell you all the time, even if you have a very pretty basket, make sure it's lined with plastic bags. All right, you want a non-leaking, fully sealable garbage bag in your garbage cans for moments like this. But very specifically, you can purchase disposable emesis bags that are literally meant specifically for vomiting that you can use, tie off, and then throw away appropriately as well. All right, semi-reclining or upright position when supine is also good for heartburn as well, okay? Definitely something that is common as that baby pushing up on all the organs is going to squish things around and make it a little bit easier for that gastric acid to come up. All right, from week 22 onward, you need to use a side lying position or a left lateral tilt while supine. All right, we're not going to lay prone, we're going to do side lying. If you lay on the left, it's going to reduce the risk of supine hypotensive syndrome. All right, the left is preferred over the right hand side when we have our pregnant clients laying down. What is supine hypotensive syndrome? Just again, a refresher, it's a drop in blood pressure from the compression of abdominal blood vessels by the pregnant uterus. All right. There's a huge correlation between women in late pregnancy who sleep supine or on the right side and stillbirth due to this being cut off. Now, is that going to happen within an hour massage? You're probably not going to have them laying for 60 full minutes on the right side. However, because of this prevalence in medical studies, we always suggest left side lying is preferred. All right, if you have a spa, a Vichy shower, other things, a sauna, all right, you can do spa bathing for 20 minutes or less. You want the hot bath to be 104 degrees or less in your saunas. A hot, dry sauna bath You want 15 or less percent humidity in there. You want it to be about 158 degrees Fahrenheit, 70 degrees Celsius. All right. You want to make sure that you do not surpass that. Anytime exceeding these or any temperature exceeding these can cause damage to the unborn baby. All right. Now, here's one to think about. Massage and deep vein thrombosis. DVT diagnoses increase during pregnancy, usually occur in the thigh or the lower leg. Your texts say to avoid the affected lower extremity. All right. Of course, if there's no diagnosis, you always want to check for leg swelling, heat, redness, pain, and avoid the area if you notice those. Left side is more common during pregnancy than the right side. Please make sure that you're checking for these things. Your text is always going to say it's a local contraindication. I, as a precautionist, will always say it is a total contraindication. I personally will not massage someone with a DVT. I am personally terrified of moving that thrombus. We don't want it to become some type of embolism traveling further. But your text, for licensing purposes, does state that it is a local contraindication. So I will leave that up to you, how you feel about safety and pathology. But please know that this is where Miss Ellis and the text very often disagree. All right. Massage and edema in the low legs, ankles, and feet during pregnancy. So if you have local edema, remember, we've talked about edema in the past. We always want to elevate the limb, right? We're always going to do light effleurage. We're going to do distal to proximal to move things upward. We do, remember from the lymphatic system, we want to stimulate those lymph nodes, which is why here it says to massage proximal and then distally, because we want to clear the fluid that is most proximal and closest to the larger nodes, to clear it first and then do the distal area. But you're going to do distal up to the nodes again. So you're going to go back over that proximal area. And remember, this is very light massage, 5 grams of pressure, basically a couple of paper clips worth of depth. Now, if there is major swelling, unilateral leg swelling from a DVT, or widespread swelling, you need to make a referral to a healthcare practitioner. All right. If that is indicated at all, please stop. Widespread edema could be a sign of preeclampsia. That is going to be a total, absolute, general contraindication for massage therapy. All right, menopause. Switching things around here. That is the end of menstruation. They have stopped. All right. You can massage anyone in menopause. They're probably going to want it. However, they may be having hot flashes and have heat intolerance. So make sure you're checking in with them about the temperature, the use of your blankets. You might not want to use hot packs or hot stones or hydroculators or hot immersion baths or your table warmer. If you usually have a table warmer on in the winter, they may want the windows open instead. So please check in with those in menopause. They are sweating. Premenstrual syndrome. All right. This volatile, emotional, chemical, hormonal time before menstruation. Massage may reduce these symptoms. However, there may be a lot of breast tenderness during this time. So, in prone positions, you may need to do some bolstering or adjusting, or prone may not be appropriate and you may need to do side lying positions. All right, dysmenorrhea we touched on before for menstrual cramps. Please know that, like I said earlier, massage can absolutely reduce the symptoms. You should factor in coexisting conditions like endometriosis may be the cause, PCOS, which is like polycystic ovarian syndrome, things of this nature. You can also teach your clients how to do self-applied abdominal massage during this time using essential oils if you know how to use them safely and you are trained to reduce menstrual pain. Now, endometriosis, as a reminder, that is the presence of endometrial tissue outside the uterus. They have even found this stuff in people's shoulders before. You think you have adhesive capsulitis? Surprise, it's endometriosis in your shoulder. This very often responds to hormone fluctuations and can thicken and degenerate and bleed wherever it is. You can administer massage for endometriosis. However, please talk to your client. Know that areas of pain and sensitivity may be a local contraindication. And if they are in higher stages of it and looking to surgery to have it removed, they may be at a stage where it is just contraindicated due to general pain. Now, uterine fibroids are also fairly common. There is no real massage consideration that your text states. However, I will say uterine fibroids can tug and feel like tight scar tissue inside of the body and pull on other areas and be incredibly painful. And if they aren't, at the time, if you try to stretch a client, that fibroid may have grabbed on, as well as endometriosis, may have grabbed onto other tissue. So when you try to stretch the body, that fibroid is grabbing onto it and pulling two things together that shouldn't be, and making it more difficult and painful to do that stretching. So make sure that you're really, really listening to that client. Those with fibroids and other uterine issues may have pain with stretching that has nothing to do with the joint, muscle, or ligament, anything in the area that you're actually trying to stretch, but rather soft tissue that feels like it's shearing from being grabbed onto in two different places by this fibroid. Endometrial or uterine cancer. You can absolutely massage just like you can with most other cancers. Just make sure that you really communicate, of course, with your health intake, with your client about current signs and symptoms, as well as any side effects of cancer treatments they may be undergoing. Same thing goes for cervical cancer. You may want to do side lying if prone with either of these is an uncomfortable position. Ovarian cysts. So these cysts are usually fluid-filled sacs within the ovary or on its surface. Polycystic ovarian syndrome is accompanied with elevated hormone levels, with irregular menstrual cycles, and bilateral enlargement of ovaries with multiple cysts. I will say this can happen unilaterally as well. You might need to modify massage for this just as a local contraindication to avoid abdomen if the pressure is causing any type of pain. It is an indication for massage, though, but just potentially local due to the pain in the area. One thing I will mention in here is you do need to ask about any comorbidities, because polycystic ovarian syndrome is due to hormone fluctuations. Very often things like Cushing's syndrome, diabetes, sleep apnea, because of the weight gain associated with this, it often pairs with hair growth and obesity in a lot of people that suffer from PCOS. Please be aware of these factors and adjust your massage accordingly. Ovarian cancer is the same as any other uterine cervical cancer. Just talk with your client about any signs, symptoms, any type of positions or local contraindications. Pelvic organ prolapse. All right, this is the displacement of pelvic organs from weakened or overstretched pelvic floor muscles and connective tissues. All right. Like uterine prolapse is the downward displacement of the uterus into or out of the vagina. You actually can do massage with organ prolapse. However, there's prone to be some pelvic floor discomfort. So you need to avoid seated or semi-reclining positions while the client is supine. You want them laying on their back, you want them side lying, you want them prone, but you do not want them in any type of way a little bit upward so that the weight of their upper body and organs is pressing down and putting pressure on that prolapse. Pelvic inflammatory disease. What do we think of when we hear inflammation? Itis. I want you to think itis, itis, itis. If it ends in itis, it's probably a contraindication, right? Cervicitis, inflammation of the cervix, endometrioitis, inflammation of the uterus. All right. Vaginitis, inflammation of the vagina, septicemia can happen from these things because these are all infections, inflammation. Septicemia is blood poisoning, right? Sepsis from bacteria or other substances. These are all contraindications to massage therapy. We leave infections and the body desperately trying to heal itself alone during this time period. The body is not ready for therapeutic change through massage therapy because it's already being taxed enough on its own. Most of these things are not going to cause any issue to you as the massage therapist in terms of being contagious. However, you are going to overly tax your client's body, thereby defeating their body's ability to heal as well as it could. All right, so here we are. Our fever, red flag, massage, and pelvic inflammatory disease, PID. Massage is 100% postponed until the condition is resolved. All right, yeast infections. It is a fungus. Please remember this for your licensing exam if asked. All right. Yes, you can massage anyone with a yeast infection. Usually, there won't be any issues with positioning with this whatsoever. Of course, as always, communicate with your client, but it's an indication you are not massaging the vagina anyway. This is out of your scope of practice and inappropriate. So a yeast infection in this area should not alter your massage in any way, shape, or form. All right, infertility isn't going to be an issue. The only thing you would need to ask about is a coexisting condition, again, something like PCOS or endometriosis. If they are undergoing IVF, you might actually help improve outcomes with massage prior to embryo transfer. After that embryo is transferred, you are going to absolutely not touch them and avoid them just like you would for a first trimester pregnancy, and make sure that you have clearance from the doctor as well to begin massage in the second trimester in case it's a high risk pregnancy of any type. But massage before the implantation can actually be very beneficial. All right. Hyperemesis gravidarum. All right. This is extreme vomiting. This is beyond normal morning sickness. This is hyperemesis. All right. Hyper meaning excessive, emesis vomiting, excessive vomiting. All right. You can massage them if they're not actively vomiting. You can use semi-reclining or upright positions. We don't want anyone choking while they're supine on their own vomit. Again, avoid techniques causing the client to rock or shake, just like we would during morning sickness. And again, plastic bag in the trash can, disposable emesis bag. But just like a lot of cancer treatments, massage has been shown to reduce nausea, symptoms of nausea in our clients. So a client experiencing this can absolutely be an indication for massage. Now, miscarriages, it is postponed until after the client has been cleared by a healthcare professional, primary care physician. Someone has said, yes, they are cleaned out, good to go, healthy, safe, ready to have it. There can be a lot of pain and cramping after this, vaginal bleeding, spotting, expulsion of additional tissue if there's still tissue in there. This is a restriction until it is thoroughly investigated and they are deemed safe by the healthcare professional. Now, after that, this may be a highly emotional time for your client, and relaxing or nurturing massage is absolutely indicated. Please remember that our first step as massage therapists is to provide a safe environment for our clients before we even touch them. So in this case, we are absolutely looking out for the well-being and care of our client. We can give them a safe and relaxing massage after we know that their body is safe to do so. Please know that there may be emotional outbursts during this time that has nothing to do with you as a massage therapist. So please note, and we'll talk about this more in the professionalism and ethics course, but this is a time for you to hold space for your client. But remember, you are a touch therapist, not a talk therapist. So please give them their space, be there for them, listen to them, but this is not in your scope of practice to give them advice. Ectopic pregnancy. This is an absolute contraindication. Definitely refer them to a healthcare professional immediately if they have any type of sharp or stabbing unilateral abdominal pelvic pain. All right. So in their abdomen or their pelvis on one side, if they're having stabbing pain and they believe themselves to be pregnant, they absolutely need to go in and have that checked out. Just like a miscarriage, which needs to be removed because it can be very fatal for the pregnant person. If that causes any type of rupture and hemorrhaging, please know that it is most likely going to end in an abortion for the parent's safety. So relaxing and nurturing massage is indicated for that client after they have been cleared by the healthcare team. Preterm labor. This is anytime we're going into labor before week 37. All right. This is a contraindication. If someone is in danger of going into preterm labor, we don't want to take any bun out of the oven early. It is not done cooking. We do not want to massage them and let them potentially go into labor even further in the massage office. We are going to give them a break, send them to their healthcare professionals. Now, if they are getting massage during a healthy pregnancy, the super cool thing is that it can reduce the risk of preterm labor. But if they're already there, the massage must be stopped. You cannot continue any treatments. I would recommend, even if the issue has resolved, say it's around like week 30, week 32, and they're going into preterm labor, I personally would not massage them again until the child has been born in case this comes back. You do not want any liability falling onto you in any way, shape, or form, even if you believe that massage is 100% safe. That is up to you in your office and what the healthcare team decides. Absolutely. I would not be able to live with myself if I caused anything potentially, or if I made the parent feel like I caused anything potentially. That being said, massage during pregnancy is wonderful and reduces the symptoms of so many other things. I would highly recommend teaching massage, not only to the pregnant person, but also to their partner, any family members or caregivers willing to give them a massage during pregnancy after the first trimester. And also considering teaching the new mom infant massage, because infant massage is incredibly beneficial for parents to learn to give to their infants. All right, let's cover some of the diseases during pregnancy. So persistent high blood pressure and protein in the urine is preeclampsia or eclampsia in pregnancy, okay? You absolutely do not massage them with eclampsia or preeclampsia. This is an absolute, total, general contraindication. You are going to watch for symptoms like widespread edema, severe headaches, visual disturbances. All right. These can all be caused by this spike in blood pressure during this gestational period. They need to be seen by a healthcare practitioner as soon as possible. What else happens during the gestational period? We also get a special form of diabetes. This is diabetes that you only have during pregnancy who did not already have diabetes. All right. It can cause excessive fetal growth, preeclampsia, and preterm birth. All right. This is another total fever red, absolute stoplight contraindication. It is postponed until it's completely managed and determined by the healthcare professional to be okay for massage. Then you can go back into standards of care. Please make sure that things like the glucose meter is close. Remember, massage can drop blood sugar, so maybe a little snacky afterwards is recommended that they bring. And if they have had any type of insulin, know that you cannot do any vigorous massage over sites of the recent injection for at least 24 hours. I recommend a little bit longer. If you're going to be doing anything vigorous, I would give it 2 days, honestly, over that particular injection site. But otherwise, you can massage as normal. Now, if the placenta is partially or covering the cervix, which is kind of rare, placenta previa, this is postponed. The client may mention this to you in passing. If they do, no, stop. You cannot massage them. You absolutely will not be massaging someone in this condition whatsoever. Same thing with placental abruption. All right. This is when the placenta separates from the uterus. It happens very often a couple of weeks before childbirth. You need to postpone the massage. If this client tells you anything is going weird in this pregnancy that is not glowing and wonderful and normal, the answer is no. We don't mess with the pregnancy unless it's normal. If it's normal, yes, massage is lovely. If it is not normal, the answer is no. All right. Prenatal depression, perinatal mood, and anxiety disorders. This is depressive mood disorder during pregnancy. This can happen not just because of environmental factors, which is understandable, but also major chemical changes and fatigue that happens. This is different from postpartum depression. This is during the pregnancy itself. You absolutely can do massage therapy, treat it like any other depressive or anxiety disorder. I encourage anyone to be taught that is a family member or caregiver to also give the pregnant person massage as well. We're going to focus on relaxing and nurturing techniques in this case. Now, postpartum depression is what we most commonly hear about. This is a depressive mood disorder after childbirth, and it's really associated with adverse mother and infant outcomes and a risk factor for low quality interactions between them. Massage is 100% indicated. It is wonderful to teach everyone to massage that person in the postpartum period, and also teaching mom and the co-parent infant massage. Again, it's really important for bonding, especially kicking in that oxytocin will help create that chemical bond as well between parents and child. So if the co-parent is also feeling depressed, I cannot tell you enough to research the effects of oxytocin that can be brought about through massage, and how oxytocin can really affect the mother-child, father-child, parent-child bond. 100% very vital, very important. All right, pathologies and disorders of the breasts. Fibrocystic breasts. This is when we get lumps and changes in the breasts. You just might need to position your client. This is not a malignant issue. Just position the client for comfort. While prone, you may need to do some interesting bolstering, or you may need to do side lying position, whatever is most comfortable for them if they're feeling some breast tenderness. Mastitis, this is an inflammation or infection of the breast. It happens a lot during lactation. Usually only one breast is affected. This is the one time I would say you can massage them unless they have a fever when we're talking about infections. Avoid the pecs and the armpit area, the axillary region. on the affected side, right? Those lymph nodes are working extra hard. Let's not tax them even more. We want to make sure all that acute local inflammation has resolved. So I would call this a local contraindication. All right. Again, breast tenderness, make sure that you are adjusting for client comfort in positioning. Breast cancer, you absolutely can massage during breast cancer. As with all other cancers, check out for other signs and symptoms, side effects of any type of cancer treatments. Make sure there's no redness, heat, any type of signs of infection that's going on. We may have other things going on as well, like osteoporosis, neuropathy, etc., especially things like adhesive capsulitis in the area, now that we're talking about cancer so close to that area and the breasts. So please just really check in. Obviously, this might be a local, but it is an indication in general for massage. Just checking in to make sure that we don't have any other signs and symptoms that we need to adjust for in the massage itself. Surgical stars, you must wait until they are in the remodeling phase. So while they are still healing, we kind of leave them alone, right? We just maybe halfway through, we can start gentle stretching to guide them to heal in the way that we want. But now, if they're fully healed, absolutely, you can use friction and skin rolling to help break them up, make them more pliable. But discontinue if they get really red, warm, or more painful. On any subsequent sessions, they may be getting infected or there may be some tissue tearing. Make sure that if they have surgical scars in the breast area, either from mastectomies, breast enlargement, breast reductions, breast removals, lumpectomy, whatever the case may be, make sure that you're following legal guidelines. You may need extra release forms if you're working around the breast, depending on where you work, to make sure that you are on the up and up and there is no misconstrued feelings or thoughts from the client whatsoever about this treatment, and make sure that you absolutely are certified and knowledgeable in what you are doing in this area. If that is the surgical scar area that you are working on, this also goes for C-section scars, as that is very, very close to the groin region. All right, the prostate, benign prostatic hyperplasia. Hyperplasia, excessive growth. So, man, we've just got a bulging prostate starting. Now, you might want to avoid massage over the abdominopelvic area. So, this is a local contraindication because it might promote the urge to urinate because that prostate gland is really pressing in there. It affects the flow of urine. All right. Suggest using the bathroom right before and right after a massage, because stimulation anywhere around this area is potentially going to make them feel like they need to urinate. Prostatitis, all right. Postponed if a fever, it's an infection. Otherwise, you can just kind of like mastitis, but in this case, we're avoiding massage over the low abdominal pelvic area. All right. Again, suggest because it's the prostate gland affecting the flow of urine, make sure that they use the toilet before and after. Prostate cancer is treated like all other cancers. Ask about current signs and symptoms as well as side effects of cancer treatments. STDs. This one's a little bit more interesting. So, with STDs, of course, we've got our bacterial infections like chlamydia and gonorrhea. We've got a systemic bacterial infection, syphilis, and our viruses, our genital herpes and genital warts, things like cold sores, which your book says is a local contraindication. But if they're open and they're scratching at them and then they go touch your doorknob, which is a fomite, then the next person grabs it and scratches their face. Is it? If you've got immunosuppressed clientele or have an immune issue yourself, I would kind of err on the side of caution with the viruses and call them total contraindications while in a period of exacerbation myself. Now, massage is postponed always, forever, if a client has a fever for any reason, right? However, if they don't have a fever, It's a local contraindication if they have any skin lesions or enlarged lymph nodes. And we also want to avoid the abdominopelvic area if any pressure causes pain due to whatever flare up they may have going on in the groin region. So, overall, STDs, as a general rule, are a local contraindication, but not necessarily just in the abdominal pelvic area. Again, you can have openings and sores, skin lesions in other areas because of these. So it really depends on the STD that your client may have and what their symptoms are presenting as. All right, that's all I have for you today on these. Again, a lot of adjustments. Important thing to know: pregnancy is a no-no in the first trimester, or if it's a high risk. Otherwise, massage is a wonderful tool for pregnant clients. Most of the reproductive issues are just going to be a local contraindication, which is nice that they can still come in despite having a pathology and get the work that they are looking for. All right, guys, I will see you on the next one. Have a great day.